So, what has South Korea done so spectacularly well, it seems, that should be set as an example for other countries? We can speak to Dr. Tina Park, co-founder of the Canadian Centre for the Responsibility to Protect. She joins me now. Your PhD looking in particular at Korea. Just talk us through how South Korea in particular did this so effectively.
Well, South Korea has done a number of things that really helped to contain the virus from early on. So first of all, they made it very clear what was happening throughout the crisis. So the Korean Center for Disease Control provided daily press briefings and 3 updates throughout the day to let all the Korean citizens know what was happening and where the latest outbreak took place. Another thing that was very distinguishable on the Korean front was the ease of access to testing centers. So in South Korea, they've set up a number of test centers as well as drive-through centers where literally you would walk in or drive through and in 10 minutes you would be tested and you would receive the result in about 5 to 6 hours over the phone. So that kind of ease of access really helped isolate the cases. And what they've called track and test and treat process has really worked well in the sense that South Korean government provided text messages to all its citizens about where the latest cases were and the route that was taken by that particular patient.
So, and just on the tracking app as well, but perhaps you could just talk to us about that as well, because that, for many people, perhaps in the West, would seem an invasion of privacy in terms of personal data. But just how far did that go?
Absolutely. There are concerns about privacy and use of personal data, but in South Korea, people are more open to having their personal data shared for the sake of public health. And what has happened in the Korean case is that there were apps developed, some by high school students, some by tech giants, as well as the government, to trace where the latest coronavirus cases were. And this particular technology used GPS technology as well as CCTVs and sometimes, credit card history, because some of the patients couldn't exactly remember where they had gone through prior to being diagnosed. But by tracing the movement, what the South Korean government was able to do was to isolate the cases and ensure that those who had encountered these patients were then also tested and then isolated if necessary.
Okay, thank you very much. Dr. Tina Park, fascinating on the situation there in South Korea.